very serious health concern because it's a lot of millions of people in America have depression, and it's actually a growing number in America too, because there's a lot of causes in America that could lead depression to the symptoms, and a lot of them would be obesity, would be health problems, be work, be a lot of things, and health is very ambiguous to diagnose because it's very subjective. I thought, after looking at all these facts, I thought, especially at the economy that we have right now, especially 80–90% who's unemployed has a major depression. So I thought that was really cool. The cause of depression is scientifically, biologically, is the three chemicals: serotonin, dopamine, epinephrine, but it's mostly on serotonin. It's if you have an excess of it, you have you're very hyper, you're very hyper, and when you have a deficiency, that's where the depression comes from. Scientifically, it's explained that serotonin is made from a protein called tryptophan hydroxylase, and when it's connected with tryptophan amino acid, that's what serotonin is called, and the excess of that will cause the hypomania, and deficiency causes the depression. The clinical symptoms is all this list, and the obvious ones: persistent sadness, anxiousness, being alone, not feeling able to be happy on the times that you used to. Like when you're ever going to a party, or wherever you're trying to hang out with your friends, you're constantly hiding away your happiness, and you're always sad. Another obvious one would be restlessness and irritability. When you're always awake, and you can also be very sleepy, and things like these symptoms causes depressions. Thanks. These are the types of depression: there's major, systemic, minor, psychotic, postpartum, seasonal, affective disorder, and bipolar disorder. The first one is the most common one. It's the one where, and I think the most devastating, because it's the one that actually gets in the way of studying, working, having fun. Dysmic is the one where it's very, it can be very severe to not enough to disable a person, but it could still prevent some of the normal activities you have in your life. Minor depression is basically a form of major. It's just that minor is very, minor, and if you have this minor depression, it can lead up to, and you can have a high risk of having a major depression. Psychotic depression only occurs when you have a severe depression with a form of psychosis, meaning you could be psychosis when you have these hallucinations, and if everybody else says that they don't believe you, that could result into a psychotic depression where you don't have the support of other people to say that you see hallucinations, and they can lead to psychotic depression. Postpartum depression is when women have is pregnant and gives birth to a baby, and right after that, she'll be very overwhelmed by the fact that she has a baby, she has to take care of it, and that could cause postpartum depression. It's a big job for a woman. Seasonal affective disorder is a person who thinks it's my favorite because it's just the fact that how weather can change your personality and how depressed or how happy. Meaning, depending on what season, let's say spring, or let's say winter. Winter doesn't have a lot of light, and that can cause seasonal affective disorder, where you become really when you become really depressed, there's no light. So, and interestingly enough, they try to fix that by using light therapy, which is basically just surrounding yourself in an environment of light. And bipolar disorder is basically a maniac dash very, very depressive illness, where at one point you can be very hyper, and it could all of a sudden just turn into a depressing event. So you have both in one person. You could turn into very, very hyper, very maniac, and automatically, out of nowhere, just be very, very depressed, or just start being really negative and pessimistic.
So fortunately, there are a lot of treatment options available, and depression is one of the most curable diseases thus far. There's been research going on, since the 1950s, when the early antidepressants, antipsychotics, tricyclic antidepressants came to market. Not came to market, but were being researched. So there's things that can be done. There's, of course, psychological treatments, such as cognitive behavioral therapy, which is when you reason out your, symptoms, especially in the case of like agoraphobia or not wanting to go out and just, staying in bed. That's a very common theme in depression. You kind of talk to your psychologist or psychiatrist about that, and you try and engage in activities, taking it slowly to get to a level where you can mentally break your fears and anxieties. There's also a medication aspect, specifically prescription pharmacological medications. These are mostly involved around serotonin, dopamine, and norepinephrine modulation, because a lot of people falsely think that a low level of serotonin or a low level of dopamine causes depression. It's actually being in harmony and in balance that causes you to not have depression. Imbalances cause depression, bipolar disorders, anxiety. And so that's going to be the main focus. But then there's also over-the-counter used treatments, such as caffeine. Caffeine, especially when you feel understimulated. There have been several papers that have linked caffeine with increased heightened levels of just activity and mood. Melatonin, for example, when you're very depressed, you can't really get a good night's sleep, so melatonin can be purchased to help you sleep at night. And then, like Steve mentioned, there's the seasonal affective disorders, light lamps that you can purchase, very common in Alaska and a lot of these upper, our pole countries where there's not a lot of light. And the light actually triggers chemical reaction in the brain that, long story short, increases levels of serotonin. Nicotine, it relieves stress and anxiety. However, it's also extremely bad for your health, but it is one of an over-the-counter remedies, namely why so many people smoke. Where you want to take a test, you go out, you smoke, you feel better. And then there are, nutrients. A lot of people don't realize that if you don't take your vitamins, omega fish oil, fats that actually are in your neurons and kind of shield them, then you can actually have imbalances and bad moods, which can lead to anxiety and depression. Finally, there are a lot of herbal supplements. For example, St. John's wort is actually prescribed in Germany for depression. It increases levels of serotonin. Ginkgo biloba as well increase levels of serotonin. That's why it's very important when you are on a prescription medication, from the pharmacy perspective, that you tell your doctor and your pharmacist what you're taking, because these things can be purchased freely. But if you overdose on St. John's wort or ginkgo biloba, you're going to have a real problem, especially with other drug interactions. Go into serotonin syndrome, for example, which is, potentially life-threatening. And then lavender, for example, is something that's used to lower anxiety.